We begin on the front lines of the drug crisis.
The U.S. Drug Enforcement Administration calls fentanyl the single deadliest drug threat this country has ever encountered, 50 times more potent than heroin.
To put that into perspective, consider this. Just 2 milligrams of fentanyl, an amount that can fit on the tip of a pencil, is enough to potentially kill.
And if you think it's only sold in dark alleys or on the dark web, think again. Reporter Heather Graf got rare access inside the DEA's lab to show you the danger and what you need to know to keep your family safe.
At the U.S. Drug Enforcement Administration's headquarters in Arlington, Virginia, you'll find the lobby walls lined with photographs, a display known as Faces of Fentanyl.
If you knew him, you loved him.
And it's here that Debbie Evans often reflects on her son's life and his death.
When I go there, I feel like I'm visiting him.
Jamie Evans was 34 years old and struggling with addiction when she lost him in early 2020.
So we went to the hospital, and, you know, he was on a ventilator.
Because he had overdosed. When did you learn fentanyl was involved?
When we got the report, the autopsy report, when we got that back. They need to figure out a way to stop it because it's killing all our kids.
According to a recent report from the National Vital Statistics System, U.S. overdose deaths involving fentanyl more than tripled between 2016 and 2021.
This is a nationwide problem.
Jared Forget is the special agent in charge of the DEA's Washington division that covers D.C., Maryland, and Virginia.
In my 20 years with DEA, this is the most deadly drug that I've seen.
What makes it so dangerous?
It's made in Mexico, largely in Mexico, by 2 cartels, Sinaloa and Cartel Jalisco, with chemicals largely sourced out of China. Because it's man-made, they were able to make it that much more potent.
And more often, he says fentanyl is being pressed into counterfeit prescription pills made to look exactly like real medications. For instance, the authentic oxycodone M30s seen here on the left and a fake version on the right.
A lot of people are taking these pills thinking that they're taking one thing when in fact they're getting a fake pill.
So a big part of the DEA's efforts focus on getting those pills off the streets. In 2022, the agency says it seized more than 58 million fentanyl-laced fake pills and 13,000 pounds of fentanyl powder, equivalent to more than 387 million lethal doses. That's enough to kill every American. And all of those pills end up in DEA laboratories like this one.
It's very scary.
Where supervisory chemist Jacqueline Brown and her team are tasked with testing the tablets.
Yeah, so there's about 14,000 pills in this bag.
Working to determine if fentanyl is present and how much of it in each tiny pill.
The chemist would take a sample, dissolve it into a solution, and then put that solution into a vial. 6 in 10 pills contains a lethal dosage.
And though they are experts in this field, Brown says even her highly trained chemists can't immediately tell the difference between counterfeit pills and the real thing.
The best advice I can give is do not take pills from anyone but a pharmacy prescribed by your doctor.
She also showed us what's being called rainbow fentanyl that almost looks like candy.
They are very dangerous.
Because the DEA believes Mexican cartels are using these brightly colored pills to target young people.
They want to get more people taking this drug so they can drive up their profit margins.
And they don't care if people die in the process?
No, they certainly don't care if people die. Young people are online, they're on different applications such as Facebook, Instagram, Snapchat, TikTok. Members of these criminal organizations are actually out there pursuing people to take these drugs and to dupe them into taking these fake pills.
What do you think it will take to stop this?
It's an ongoing battle, and we work every single day. DEA, we can't do it alone. And when I say that, of course, we have to work with our law enforcement partners, and we do that, and we do it very well.
The analysis done in this lab often key in sending drug dealers to prison.
We take the results of their testing and then we use that in court.
But Special Agent Forget will tell you they also need help in the form of public awareness about the dangers of fentanyl and fake pills.
It takes the entire community. It takes all of us.
You don't want another mom to feel like I do.
It's why Debbie Evans now shares her son's story every chance she gets, from rallies and marches in the nation's capital to online forums and Facebook groups, to the artwork that's become her own version of the DEA's Faces of Fentanyl display.
Jacob and Keen.
Often used as a visual when she speaks to parents and even lawmakers.
I started doing it to honor Jamie.
This ever-growing collage depicts Jamie alongside dozens of others whose families Debbie has gotten to know over the last few years.
These are all his new friends in heaven now.
Families that, like hers, were forever changed by fentanyl.
I think it'll help other people, you know, if they see moms putting out the stories of their children and how fentanyl is killing them, that maybe they'll be a little more aware and they won't have to have that happen to them. You can't describe how much it hurts every day.
According to the CDC, U.S. overdose deaths topped 100,000 in 2021 and again in 2022. The DEA says there is no question illicit fentanyl is fueling those numbers.
And we're going in depth with advice on how to talk to your family about this.
The DEA's One Pill Can Kill campaign reminds people to avoid any pill that isn't prescribed by your own doctor.
It also warns of emoji drug codes being used between drug dealers and teens. Keep an eye out for these, representing fake Percocet, oxycodone, Xanax, and Adderall. And make sure your child knows no pill on social media is safe.
Another tip for parents is to help your kids create an exit plan so they know what to do if a friend is pressuring them.